Hello. Anyone you want me to pop in and see? I'm not kidding. No, I'm dead serious. Who you got?
One here. So this is a 51-year-old with history of Crohn's who comes in with near syncopal episode after working out on his elliptical machine.
Yeah, that sounds serious. Okay. Who's fielding it? Jeff.
You said 10 minutes though. Approximately.
What we got?
10 minutes. Okay, that's what they thought. Yeah, that's what they were guessing how long she was down.
Yeah.
She just found down pulseless.
Tell me if you need a break call. Somebody want to write for me, Rachel? Yeah.
Down, I guess. They were doing CPR.
They were upset about it, so I don't know what kind of relationship they had with her, but she was all there by the sounds of it.
Yeah, there you go. Go up to babies. Feeding.
Yeah, sounds good. Continue.
Yeah, her belly was big.
Yeah.
Listened about 4 or 5 times on the way
I can do
over.
this one.
Just making sure she doesn't have a
Does she have a
pneumo or
pulse?
something we can fix. No pulse.
That's the other reason why we usually throw them in the head blocks, is trying to stabilize.
Is anybody writing anything down?
Yeah.
Great breath sounds.
Yeah, no. Tube's good.
Is she anticoagulated or is she bleeding down here? I don't know what that's all about.
Caitlin, what else do you think might be impressive?
So what was going on?
That was a woman they found down in the nursing home she lived in, and she didn't have a pulse. The ENTs immediately started basically trying to do resuscitation, and we continued while she was here and went through just several rounds of the various drugs, trying to get a discernible pulse or a rhythm that we could do something with. But I think whatever been going on, she'd probably been without a pulse for long enough that all of the efforts to get her heart restarted, none of them were very successful. So we probably were in there working on her for about 35 or 40 minutes, and after that, that's usually, if you don't have them back by then, it's around the time you stop resuscitating. So the first thing you do is you check her on the monitor, just see what sort of electrical rhythm her heart is showing. That's going to dictate whether or not you can shock her either back into a normal rhythm that'll give her pulses throughout her body, or whether or not you need to administer drugs. And we can give drugs like epinephrine or atropine to try and kickstart the heart. That's like high dose adrenaline to get the heart racing and moving. We tried a few rounds of that, and we're able to get an electrical rhythm, not a very organized one, not one that was compatible with life, but we were able to get some sort of signal on the monitor. But as I was feeling for pulses, there were not any pulses in either the arteries in her neck or the arteries in her leg. And those are sort of the first areas you'd feel a pulse, even if it was a really weak one. So I did that. We all have to take turns doing compressions, of course, because it's actually hard work when you're in there. You have to maintain 100 beats per minute with enough force that you're feeling pulses. You can actually feel the pulses produced by chest compressions if you're doing them right. So we did that. We had her with a tube in her throat, or into her airway, to inflate her lungs for her. And so there's a guy doing that. Then the other things we were checking for, we used the ultrasound machine to get sort of a very rough picture of her heart to see if it was even responding at all. A good sign would have been, as we were giving the drugs or as we were shocking the heart, to see her heart at least making some efforts towards pumping. We actually saw no movement on ultrasound, so that was pretty good evidence that for as long as she had been down, her heart had probably sustained an injury that was all but irreversible. It's difficult. You walk into the room and you try and immediately assess, where you are on the spectrum between, life and death. And someone who's been down for an extended period of time with no pulse for that long, going into it that the chances are really, really low that you'll be able to get that person back. So your criteria for success are pretty low. If we could have at least just gotten a pulse and we could have hooked her up on the ventilator, we could have seen with time if she would have begun to show any you know, recovery, either via her brain waves or heart beating or able to spontaneously breathe on her own. But when you're not able to even get something as simple as a pulse or any movement on the heart ultrasound, that's your opportunity for success is just so low that, you know, the most realistic thing to do is to acknowledge that your efforts are futile and let go of the situation.